Dr. Nicholas Chew, a specialist in infectious diseases based in Farrer Park Hospital, and I would like to address several important questions about how to take care of yourself and your family during these very difficult times. Many people who have been infected, especially early on in the course of the illness, are asymptomatic. This means that they have absolutely no symptoms and may not even be aware that they pose a risk to themselves, their families, and to the general public. From what we know, the other difficulty with COVID-19 is that this virus has the potential to survive on surfaces and non-living items for several days. I would suggest that you only go out when it is absolutely essential and to try and avoid leaving the house if at all possible. If you do need to leave the house, I would strongly suggest that you follow the government recommendations and guidelines. This would include wearing a mask when you go out and also to maintain a safe distance from anyone else. Try to avoid touching your eyes, nose or mouth at all times. Also avoid touching any surfaces or inanimate objects if possible. If you do have to touch these items, which would be quite common when you go out shopping, I would strongly recommend that you wash your hands often using soap and water or an alcohol-based hand rub. The vast majority of patients will complain of very non-specific upper respiratory tract symptoms, including a cough, nasal discharge, a sore throat, and possibly a fever as well. The known incubation period for COVID-19 is quite varied, and symptoms may appear anywhere between 2 to 14 days after the actual exposure. This would make clinical diagnosis very difficult, and because of that, if any of you become unwell, the best thing to do is to stay at home, put on a mask, and also then ring your GP for clarification. We must not forget that people will suffer from all the other non-COVID infections and also other medical conditions. For example, diabetes, heart disease, hypertension, and such like. If you think that you will run out of your medication during the circuit breaker period, I would strongly suggest that you contact your GP or your local pharmacy to try and get sufficient supply. Both my sons are very active, competitive soccer players. So for them, they still keep up with their training even with a small area at home, and they go online and they are interacting with their teammates and coaches every day. For all of you, I would suggest that you do something similar depending on what your sports and areas of interest are, and go online and see whether or not there are any suitable and interesting programs that you may try out and adhere to.